Well, hello, Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And here at Gold, we're getting ready for our Gold Midwifery online conference of 2026. And with me here is Nicole Morales. Welcome, Nicole.
Thank you for having me, Kristen.
And I should say welcome back because you've been with us before. So
Yeah.
it's it's wonderful to have you back. This year you're coming back as our keynote presenter, and I'm so happy to have you in this role because the topic is an important one. It's all about shoulder dystocia beyond biomechanics. Woof. That's a big one, a big topic, and if anybody can present it, it's you, Nicole. But before we hop into this topic, tell us a little bit about yourself, where in the world you are, and tell us a little bit about your background.
So I'm in San Diego, California. I'm a home birth midwife here with a small home birth practice. I also am an instructor for spinning babies. I also am part of Restory Birth Work, which is uh, a midwifery educational business that's changing the narrative of midwifery education. A lot of it is, and similar to the talk I'm going to give on beyond biomechanics, it's really looking at the nervous system in birth work, not just of people that we're serving, but of the midwife themselves and how that affects the decision-making processes that we have for birth work. And so right now that's my passion is how we shift those conversations in a midwifery model.
And that's what you're going to be doing here for us as well. I'm so happy that we're talking about this because when we talk of something like shoulder dystocia, we always often talk about the biomechanics of it, right? What we need to do, the drills and all that. But we're also, as midwives, we're also people, right? And,
Yes.
and we're not just the midwives in the room. There's family in the room. There is, of course, the mom, the birthing person, the partner, if there is one, maybe other family, friend. So there is a whole dynamic going on, right? And so it is, and that's why your title is also titled Beyond the Biomechanics, because there is a lot going on. And talking about the shoulder dystocia. Of course, that's a big one. And every midwife, I can feel it in myself that immediately I hold my breath when I just think about it and hear about it. Um, let's talk about a few myths. Let's start off with that. How, shoulder dystocia got such a, scary, we're talking, it's like a scary subject. What other myths are there with oversimplifications about the topic? Talk a little bit briefly about that background of the topic of shoulder dystocia.
Well, I think that so much of our education about shoulder dystocia has been, you've got so many different things here, but one of them is that, within the medical paradigm, a lot of what's only recognized is a single inlet shoulder dystocia for births.
Hmm.
And I think it's useful to think about like all of the different things you mentioned with some would say at crisis
Hmm.
management with a shoulder dystocia versus really understanding what's happening on the inside of the pelvis
Hmm.
from the outside, which gives us a broader perspective of what we can do before the birth, after the birth, and during the birth, and it being able to understand that there's more than one place that shoulders can get caught and more than one type of shoulder dystocia that occurs. And then, of course, there's things that look like shoulder dystocias and may not be classified as shoulder dystocia, but I've got a saying that if it looks like a shoulder dystocia and acts like a shoulder dystocia and resolved like a shoulder dystocia, then I don't care if it is or not. But the thing is, how do we help these babies be born
Right.
with the most ease and safety that we can?
Yeah, absolutely. Then it doesn't matter what it's called. Our job is to be there and facilitate the birth. And I love how you speak about kind of, if I can understand this right, it's almost like you're reframing it a little bit. It sounds to me like instead of framing it as a catastrophe into something more like, okay, preparedness, right?
Yes, I mean, I think the other thing is that when we know something and become from familiar with it, there's less panic involved with it.
Mm-hmm.
And so, us understanding the not just some of this is biomechanics, the space that's
Right.
involved, and some of the art and craft of midwifery in general is understanding. how do you facilitate more space where the
Hmm.
baby happens to be?
Hmm.
And for this is really thinking about the shoulder rotations and
Hmm.
descent and how that can be compromised, or also, how we can restore the proper rotations for the shoulders as the baby comes down through the pelvis and emerges.
Absolutely. That makes a lot of sense as well. Um, you spoke a little bit about, you mentioned panic earlier on, panic in the care provider because this is, if we talk about this as an emergency, but also for the birthing person and or the mother, even in pregnancy, they sometimes are coming, words are coming up like big baby, for example, right? Or
Yes.
if you post-date, you have to have that baby now. If you are after 40 weeks, oh my gosh, you have that big baby. So we also have to work a little bit with that because our clients might be coming in with that kind of fear already, right?
Yes. Yeah. Fear around shoulder dystocia. I actually think that fear of shoulder dystocia is one of the top reasons for cesarean birth
Hmm.
right now
Hmm.
in the United States. And that's the big baby, the long pushing phase, the long labor.
Hmm.
Babies are being identified at 20 weeks as having large abdominal circumferences,
Hmm.
and we we and what we know is ahead of time, the evidence shows that what makes somebody more at risk of having a shoulder dystocia are people thinking that they are going to have a shoulder dystocia. And so, and we can't predict, and prediction of the size of babies is not helping out with, that's not evidence-based. And so we do have to think about how panic actually affects the birth room and how one-step delivery or other
Hmm.
interventions actually raise the rates of shoulder dystocia.
Hmm.
So and the hope is that in naming things and naming when things are deviating from normal, that we're able to keep the provider is able to stay calmer because they're already knowing what they see. And
Hmm.
when you know what you see, it's an interesting thing that happens. Sometimes it's easier because with turtling, and a shoulder dystocia, you already know you have to go in and help the baby, but sometimes there's this in between time
Yeah. Hmm.
that some call midwifery, right? And I'm not the first to use the term, but that midwifery place where you're like, oh no, not now.
Hmm.
Or maybe your nervous system reaction is freezing because, of course, you're the hands-off midwife who doesn't want to
Yeah.
interrupt this beautiful moment that's
Yeah.
unfolding. And what if you do something to interrupt?
Interrupt. Hmm.
And so sometimes that holds us back from actually helping a baby that's asking for help. So I think that partly, it's all these places of getting to know how we act as providers or as
Hmm.
practitioners or how we act as assistants, um,
Hmm.
how we can help with a mother in preparation for any birth or any
Hmm.
place of unknowing.
Hmm.
And I think in this particular talk that I'm going to do, I am going to address, a couple births where I feel like the nervous system of the practitioner, meaning me, interfered with. I mean, all was well in the end, but um, things could have gone more smoothly had I been more able to understand more about my own nervous system,
Hmm.
and how I was affected by a specific moment, right?
Hmm.
And that includes in preventing shoulder dystocias or ways of even like um, how we can, when we expect a shoulder dystocia to happen, how do we begin to think about the biomechanics before, rather than just waiting for it to happen, and understanding what's happening on the inside?
Absolutely. I love how you put that about the nervous system, and thank you also for sharing about your own stories. I mean, that is so important, right? We are constantly learning and we're still, developing. And it is, thank you so much for sharing that, about your own, sharing your own vulnerability there. I think that's very meaningful to midwives because we always think like, oh, is this just me or what's going on?
Yeah.
So it's so important.
Well, I think
Now,
that, that
yeah, go
that's
ahead.
that's kind of the thing is that we have to learn somehow,
Mm-hmm.
right? And it's not
Yeah.
like we arrive with shoulder
No. Mm-mm.
dystocia, like, oh, well, I've
Yeah.
arrived. Or, I think that humility keeps us more present and
Yes. Mm-hmm.
curious and also allows us to grow,
Mm-hmm.
um,
Mm-hmm.
be human, and
Yes.
also allows us to make the repair.
Yes, absolutely. Absolutely. I like everything you just said. It speaks to me a lot. And something else I've been just thinking about, you talked about the nervous system of the provider. Now we all know about birth trauma, and a shoulder dystocia and the management of it can result in tremendous birth trauma for your clients, for the birthing person, even if in the end everything goes well.
Yes.
Is there something as providers, besides meaning obviously staying calm, that we can do to, deliver respectful management, even having that in mind, not just jumping into action. Of course, we need to save that baby, but what can we do to kind of, keep in mind also what kind of effect that will have on maybe lifelong, right? Because these women, we all remember our birth for the rest of our lives, right? So,
Yeah.
yes, of course, the main priority is to get that baby, out safely. But what is your tip for that?
Well, ideally, it would start in pregnancy with developing a trusting relationship. And
Mm-hmm.
so that the family knows that we're going to make the repair on the other side.
Mm-hmm.
And that they trust that when we say, hey, this needs to happen now, that they know that we wouldn't ask for it unless we really needed it.
Needed it. Yeah.
So I think that developing relationship, even in talking about shoulder dystocia, right,
All right.
is really part of that. And then also, taking a breath ourselves. We have
Mm-hmm.
time to take a breath and um, orient ourselves and
Mm-hmm.
even be able to name what we're seeing and what we're going to need to do aloud so that the family or the birth giver really, the mother can hear us
Mm-hmm.
and know, like, oh, there's a purpose here.
Mm-hmm.
They're doing
Yeah.
this for a reason. And I think also it's the birth team practice.
Yes,
I
that's a
find
big one.
that when I'm with my own birth team, everything goes so much more smoothly because we've worked together.
Mm-hmm.
We don't completely read each other's mind, but we get pretty close. But it's like, all right, this is what's happening. We name it aloud, and then each person moves into what we've practiced in a simulation.
Mm-hmm.
But also, if we've attended shoulder dystocias together prior, it can sometimes seem a lot smoother. And then, of course, at the end, how we bring baby back to the chest
Yes,
or
yes.
even that skin to skin following,
Mm-hmm.
even if we had breaths or resuscitation that occurred, that we bring, baby back into restoring its nervous system
Yes.
and then also attend to ourselves, right?
Mm-hmm.
I tend to be kind of smooth at birth and fall apart 2 days later. I call it a shoulder dystocia hangover.
Oh,
Um,
that's a good word for it.
but and other people tend to might handle it differently. So I think
Mm-hmm.
also in tracking our own nervous systems at other
Mm-hmm.
births
Mm-hmm.
that we attend, and then also leaning on community.
Yeah.
Who's our
Yes.
community who can show up for us to maybe suture after a hard birth or
Mm-hmm.
come to review your chart
Mm-hmm.
to feed you.
Yeah.
So I think sometimes we don't have those structures in place, even amongst friends when we could have those structures in
Mm.
place.
Oh, Nicole, such wise words here. I could talk to you for hours. This is so much wisdom that you're sharing here with us about this topic, and I am so glad you're here with us today, chatting with us, and I can't wait for your presentation. So thank you for so much for being here with us today at Gold.
Thank you for having me.
And some information for our viewers. I know after you heard from Nicole, I know you want to be there for this live keynote presentation. Nicole is actually presenting twice on February 2nd. Not to worry, this is also being recorded, so you can watch that at any time. This presentation, because it's such an important topic, here at Gold, our keynote presentations are open access. So this presentation is available to everyone. So we invite you to go to goldmidwifery.com and you'll find all the times there. You can sign up and reserve your free seat. Please share this information, share the links also with your friends and colleagues in birth work. We want to make sure that everybody sees this wonderful presentations and learns from Nicole. Thank you everyone for watching here today, and we hope to see you at the conference. Bye bye, everyone.